I thought it would be helpful to show you some of the equipment that we use during a C-section. This is not designed to teach you how to do your own C-section or teach your partner how to do a C-section. It's really just an idea because when you come in the room, you're going to see all this stuff and it's going to be fairly intimidating. So I thought if you could at least have seen it once and understand why it's there and what we do with it, it may be less intimidating for you. First thing you have to understand about surgery is we operate on the idea of overkill. We want to have more equipment than we could possibly use because we don't want to be caught where we have an emergency and we don't have something that we need. So you're going to see a lot of equipment, most of which never gets used in a C-section. The other thing is that each of us have our own style and we each prefer different equipment at different places. And so they have standard C-section packs that have all that equipment for each one of our individual doctors in the hospital. So we don't have to make an individual pack for each one of us. So that's why you're going to see a lot more equipment than we really use. So let's start off by looking at the surgical equipment, basically the metal stuff. So this is the metal equipment that we use, and there's all kinds of different equipment in different shapes and sizes, all designed to do special things. So for instance, this is a needle driver. It opens and closes, it locks, and it holds the needle, the suture, so that we can sew things up. We have all kinds of different, what we call forceps or pickups. They have different designs on them that really do different jobs, and we use different kind of pickups for different kind of things during the surgery. This is what the scalpel looks like before we put the blade on it. We've got scissors in all kinds of shapes and sizes that do different functions. We have retractors. These are instruments that are designed to move your tissue out of the way to help us see what we need to see to operate safely. And then in here are even more pieces of equipment, that, again, overkill, way more equipment than we would ever need. So what will typically happen is the scrub nurse will take out the stuff that she thinks we're most likely to need and put that right at hand, but then if we need something extra, she can reach in here to get it. Okay, now, over here is the disposable stuff. And what we have, this is a pack of sponges. So these generally come in packs of 5. The nurse will count them 1, 2, 3, 4, 5 to make sure they were packaged correctly. And these basically open up and they're used to wipe things off, or they're put inside to pack things out of the way. You hear this on MASH when they ask for sponges. This is what they're talking about. This is an operating room sponge. And they've got this blue stuff in here, which is what's called radio opaque, which means it shows up on an X-ray. They have basically operating room towels. These are used to drape things or clean stuff up. They're also used to dry our hands. So what will happen when the doctor comes into the operating room, he'll have scrubbed his hands, and he'll be coming in with his hands held up like this. He'll be given a towel where he'll dry his hands. That will then be thrown off the field. And then he'll be given a gown. I've got one open here. And the arms will go through here, and then the gloves will be put over the hands, of course, on the gown. And so this is what they're wearing. Now, the reason we wear a gown is twofold. Number one, it protects you because these are sterile, so any bacteria or contamination that comes from us won't be able to get through to you. It also protects us because these are waterproof, water resistant, so when stuff splashes and messes happen, it doesn't get all over us. So it has a sort of twofold important reason. This is suction. We'll be hooking this up to a suction machine, and this will suck up whatever liquids there are to deal with. And then there's under here is the big drape. This goes completely over your body, and like I told you, it goes in front of your face, so you don't have to be able to see what's going on. We also have a suction bulb for the baby. This is a little magnet that holds the needles, and these here are what I was telling you. I was jokingly referring to the light condoms. So this goes on those pegs on the light so that we can hold them sterilely. Here we have the different types of suture, and there's all kinds. This is a chromic, this is a Vicryl, this is what's called a plain gut. And each of us have our own preferences of what suture we want to use in each part of the surgery. And so the nurse will, what we call pull, or basically they'll get the suture out of the cupboard and they'll put it on the table for the individual physician that's going to be doing the surgery based on his or her preferences. There's also some Steri-Strips. These are like Scotch tape things that help hold the wound together.
Medtwice.com